Hi, all. Today we'll focus on one of the most critical parts of patient assessment, the history of presenting symptoms. Once you've established why the patient has come to see you, the next step is to explore their main symptoms in detail. Begin by listening carefully to their response to your initial open ended question. Let them describe how their problem began and how it has developed over time. As they speak, identify the two or three key symptoms they mention, for example, pain, cough, or fever. These form the core of the presenting history. It often helps to jot down these symptoms as single words, leaving space for notes and clarifications as the conversation continues. Experienced clinicians don't rely on memorized questions. Instead, they recognize patterns of symptoms that suggest certain diagnoses. With time, you'll start forming a differential diagnosis in your mind and will adapt your questions accordingly to confirm or rule out possibilities. Always clarify what the patient means by certain words. Everyday terms like kata, fits, or blackouts can mean very different things to different people. Never assume. Ask what they mean in their own words. Each clear answer either increases or decreases the likelihood of particular conditions and helps narrow down your diagnostic possibilities. Next, assess how the illness affects the patient's daily life. The same symptom can have very different impacts depending on the person. For example, breathlessness might stop a 40-year-old construction worker from doing his job, while a retired person may barely notice it. You can ask questions such as, how far can you walk on a good day? Or, how has that changed since you've been unwell? Also, inquire about regular activities or exercise and whether they've had to reduce or stop them because of their symptoms. This gives you a sense of functional impact and disease severity. Finally, remember that medicine isn't just about symptoms, it's about people. Explore the patient's own perspective, often called ICE, ideas, concerns, and expectations. These can emerge naturally during the discussion, or you may need to ask directly. For example, do you have any ideas about what might be happening? What's your biggest worry about this problem? What were you hoping I could do for you today? Understanding the patient's ideas and expectations helps build trust and ensures your management plan truly addresses their needs. To summarize, a good history of presenting symptoms combines listening, clinical reasoning, and empathy. You're not just collecting data, you're understanding a person's experience